Welcome to the online Advanced Surgeons Bariatric Seminar. We're here with Dr. Scott Pennington and we're talking about bariatric surgery today. And Dr. Pennington, if you will, what exactly makes a good candidate for someone to have bariatric surgery?
Well, there are pretty well-defined parameters. A person has to have a BMI of 35 or greater and have some medical conditions that accompany that, Tiffany, or they have to have a BMI of 40 or greater. Most insurance policies will cover 40 or greater with one or more medical conditions that qualify. A BMI, for those who are not familiar, is body mass index. That's a way to relate the patient's height to his or her weight so that we can really make accurate comparisons. You know, if you're a 6'9" lineman for the San Diego Chargers and your BMI is 40, you're probably not that overweight. But if you weigh 310 pounds and you're 6'9", your BMI is actually probably about 30. But if you're a 5'1" secretary and you weigh 300 pounds, then your BMI is going to be way over 40. So it's a way to compare apples to apples and really assess the severity of the obesity. So again, anyone with a BMI of 35 or greater with a couple of comorbid conditions, like usually the medical conditions that we're looking at are things like high blood pressure, diabetes, coronary artery disease or some kind of heart disease, or sleep apnea, sleep disturbance, where patients experience obstruction of the airway when they're trying to breathe at night.
Well, we all are probably aware of the obesity problem that we have in America, but if you will, outline or talk to us about some of the contributing factors to obesity.
Well, obesity is, I'll confess from a medical standpoint, it's pretty complex and it is really a disease. There's a lot of research being done to look at the different contributing factors, everything from environmental but also to genetic, gut hormones, the way patients metabolize their food intake. There are hundreds of articles coming out regularly to look at all the factors that may contribute, but one could sort of boil it down by saying that just two main issues, and one is environmental factor, the other is genetic predisposition. And we know now that patients are genetically predisposed. That is, they inherit a metabolism or a metabolic rate that predisposes them to store energy instead of using it effectively. So for example, I might be able to eat 2,000 calories a day and not gain weight, whereas a patient who has the proper genetic predisposition might gain weight on a 1,500 calorie diet a day, and we might do the same thing activity-wise. So there's definitely that predisposition.
Well, for folks who are living in the South, and obviously your practice is here in the South, is that, you talk about environmental issues, does that play a bigger role because we're in the South and a lot of folks in the South love rich food? Well,
yeah, maybe we appreciate those good foods, but it certainly does. We're culturally, I think that we tend to lean toward fried foods, heavy starches, things that might predispose us, high-calorie diets. So that doesn't help. Also, it's more universal today, Tiffany, because basically we're wealthier than we were 100 years ago as a population, and fast foods are available, and we live at a fast pace. So the typical scenario is patients don't want to take time to eat. They send out for their next meal, and they send out to a fast food restaurant that has great tasting food, and it's cheap, and it's quick, and it's just hard not to go down that pathway. But if one does it over and over again, then the calorie intake is generally higher. So you can look at demographics and you can see that 30 years ago, the average calorie intake of our United States population was a lot less than it is today. So the gene The genetic predisposition was there, but we didn't eat the same way, and we were probably more active overall as a population, so we're not using those calories.
So Dr. Pennington, for folks that are watching this and they may have a question of why would you choose a surgical procedure versus a non-surgical procedure to help them in their weight loss journey, so what would your answer be to that?
Well, again, I'm a little biased, but I think the statistics bear out that surgical treatment of morbid or severe obesity is much more effective, at least today. There's a lot of research being done, but there are billions of dollars spent in the United States alone each year for medical weight loss programs. And that includes everything from prescription drugs, physician assistants, more casual programs like Weight Watchers versus very strict physician-assisted programs. The success rate overall is about 5%. So that means 1 in 20 patients who invest the time and the money in those programs can expect to lose a significant amount of weight and to maintain that weight loss for 6 months or longer. So compared to that, surgical treatment is very effective. If a patient qualifies for surgery, then he or she on the average can expect to lose at least 50% of their excess body weight, and many lose much more. We have many patients in our practice who've lost 100% of their excess body weight. So it's very effective compared to medical treatment.
Well, what would you say sets you guys apart at Advanced Surgeons weight loss program?
I would say that the real secret is in our staff and our overall program. And that, when I say staff, that includes the hospital staff as well. But the way we approach surgical treatment is that it's not just the surgery itself that makes the patient successful, and that's proven by the data. The surgery we like to refer to, Tiffany, as a tool. So we give the patient a tool to help him or her lose weight, and then like any tool, the better one knows how to use it and maintain the tool, then the better that person will do, the more successful they'll be. And so that starts with having trained staff. We have a bariatric coordinator in our office who has been doing this for years. And so we'll introduce, once we've seen the patient and access the patient, we'll introduce our patients to that person, and she'll plan the training schedule for that person, make sure that all the nuts and bolts of insurance approval, et cetera, are done. And then they'll be introduced to our counselors. We have 2 full-time counselors. One is a registered dietitian, and the other is a personal trainer, certified personal trainer, but also a mental health counselor. So the dietitian, it's a little bit common sense, but the more one knows about calories and protein, the better that person can use the tool and balance their diet and lose weight healthily. Yeah. And then the personal trainer part, intuitively makes sense. We try to help our patients be more physically active so that they're burning calories and complementing what they're trying to do with their weight loss. And we're not trying, I tell our patients, we're not trying to make Olympic athletes out of them, although some of them may become that. But what we're trying to do is provide a practical way for them to be more active. And it may be something as simple as parking a block away from their office and walking instead of engaging in going to the gym for an hour. It might include going to the gym a few times a week. But again, we're trying to make it practical. And finally, I think another important part is the mental health counseling. I tell patients that after these surgeries, they should expect to change their lifestyle, and that we can guarantee them that the surgery will take away their physical appetite, the physical drive to eat. However, we're complicated people, human beings, and we know that they're emotional, psychological, they're social, they're spiritual factors in a person's drive and their hunger and their appetite. So we try to deal with those, and we try to help the patients get insight into those aspects of their eating habits and make the lifestyle changes that they need to make to be successful.
Well, talk to us next about Reshape. What is that about?
Reshape is another option that we have for our patients, and this is a surgical interventional option, but it is done endoscopically with a scope. That is, instead of making an incision on the body, we place a balloon through the mouth into the patient's stomach, and we inflate the balloon. This is done under anesthesia, so the patients are not aware, but it's an outpatient procedure. So the balloon is gauged to fit the patient and their size, and it's inflated. The balloon is full of saline, and it's actually a double balloon that we use that fits the shape of the stomach better. That balloon can stay in place for 6 months. And what it does is it decreases the patient's appetite, and it increases their satiety, which means they feel full and satisfied sooner with a smaller amount of food. And while that's taking place, they begin to be counseled and coached about their lifestyle and their eating habits. And this is a pretty intensive program, so they're meeting with our counselors from every 2 weeks to every month for a full year. Now the balloon has to come out by FDA regulation in 6 months, but it can be replaced, but it has to come out for a short period of time. So that's another way that it's sort of an in-between program in terms of invasiveness and effectiveness. It's not as effective as bariatric surgery, and at this time insurance doesn't pay for it.
Well, on that note, that is important to know. If you are possibly interested in bariatric surgery, you're encouraged to call your insurance company, and then, of course, call the folks here at Advanced Surgeons PC at Grandview Medical Center for a consultation.